So what I want to do is kind of walk you through the difference between ADHD and bipolar more sort of qualitatively. And that is, look at the course. Bipolar has some cycling to it. ADHD is constant. It's white noise. The impairment is moderate with ADHD. Some people have severe impairment. Don't get me wrong. It can be a very severe illness. But it's more in the moderate range when you look at large samples. But if you look at bipolar disorder, it is severe. I mean, the moderate, the functioning for ADHD, even when they're bad, is over here. This is normal functioning is here. For bipolar, it's always a lot lower. The effective structure makes ADHD better, right? Take an ADHD kid who's bouncing all over the place, put him in the front, provide an aid, and you get a lot of the way there. They get better right in front of your eyes. Do that with somebody with bipolar disorder, it may even get more explosive. It has very limited utility when somebody is manic. And same with the environment. The environment can do some stuff in terms of triggering ADHD. A bad environment will make it worse. But for bipolar, the environment can really trigger it. So if there's a fight, if there's a situation where there's been, you know, it's an unfortunate where a parent hits a kid who has bipolar disorder, you can see it spin out of control. The kid can get rageful and accelerate out of control very quickly. In terms of some of the symptoms, it's similar to that one slide I showed. For a lot of the ADHD symptoms, ADHD by definition has them, you've got them, but bipolar may even have even more of those, especially during manic episodes. Depression, demoralization, feeling down could be part of ADHD, but frank depression is much more common with bipolar disorder. Substance use disorders, ADHD increases the risk for that. I've spent a lot of time mapping that out, but so does bipolar disorder. And you heard about it earlier, and I absolutely agree with some of the etiologies of that, but bipolar disorder, if you don't treat bipolar disorder, 65% of individuals with bipolar disorder will have a substance use disorder as they age into young adulthood. Sleep disruption is, you see it in ADHD, but you see it much more severe, and you heard about that in the previous lecture. And then psychosis is not part of ADHD.